What I want to do is ask two questions to the panelists. So one question, and what I would like the panelists to do is to maybe use one or two of the themes as examples in their responses. The first question is, what is your vision for enhanced cross-border collaboration on some particular theme by 2030? And the second question is, what one or two concrete steps could you take in your own context to move in the direction of this vision? And we're very happy to have with us, I think, digitally, Alison Mawson from EuroHealthNet and Karam Adel Ali from ECDC, as well as two colleagues in the room, Jonas Sivile from the Finnish Public Health Authority. Do you want to come and sit in one of the chairs on the stage? And the head of the Swedish vaccination program, Søren Andersen. So we'll go, is it okay, Olivia, if we go straight into the... Yes, Karam is there. Is Alison there? Yes. Great, hi. So if I start with Alison, on a couple of the topics that we've picked out as themes for possible cross-border collaboration, could you tell us for 1 or 2 minutes what would be your vision for enhanced cross-border collaboration by 2030?
Sure. Thank you so much, Sarah and Søren, for this, for the presentation, and to everyone for the opportunity to come and speak. It's really a pleasure to be here as we've been closely following your work over the last few years. So I'd like to say that I'm speaking today not only on behalf of EuroHealthNet and the Immunion project, one of these third health program projects that you mentioned, but also on behalf of a wider group of ongoing Horizon Europe and EU health program projects. So I would say each of us represents a cross-border collaboration in our own right, but we've also started to recently collaborate amongst projects, cross-project collaboration, because we see that this is another area where we can really make a greater impact. So we've been having a series of teleconferences and establishing some working groups to work together on common themes. And I'm really happy to say that the focus areas of our projects and of these working groups very closely mirrors these areas that you have just outlined, these 13 areas for potential collaboration. So you've talked about training of healthcare workers. That's a central theme in a number of the projects. So we're engaging to make sure that as we make requests of healthcare workers, we're not asking them to fill repeated similar surveys. We're really trying to coordinate our efforts so that we don't burn them out, and so that what we create in service of these healthcare workers is as effective as it can be. And we're also coordinating with one another and with the WHO Europe Regional Office on a sort of one voice key message, as you've mentioned, right now specifically around the European Immunization Week that will come at the end of April that you've already mentioned. So in preparation for today, I asked some of the other project coordinators what are the key benefits that they see of teaming up and working together across borders. And they really stressed the importance of preventing reinventing the wheel. So, for example, when it comes to measuring vaccine hesitancy, and also exchanging on the benefits and challenges of various research approaches. They also talked about enabling cross-country perspectives, such as identifying patterns that we see in fake news or in vaccination myths, while acknowledging country-specific issues. They talked about increasing the generalizability of the results of our projects and improving understanding of various models of vaccine provision, greater translation of key insights into multiple languages and contexts, and contributing to keeping this issue of vaccine hesitancy high on European and national public health agendas. So my vision then for 2030 would really be to establish more formal mechanisms to maintain this sort of collaboration across borders and across projects and across initiatives that all share similar aims. And I was really pleased to hear that in the welcoming remarks this morning as well, a kind of focus on what are the next steps and how do we continue to work together. So I'm sure I've gone over my time. I can close there for now, but looking forward to other remarks. Thank you.
Great, thanks so much. I'm going to move straight on to Karam Adel Ali from ECDC. Please tell us, what is your vision for enhanced cross-border collaboration by 2030?
Hi, Sarah, and good morning, everybody. And thank you for inviting us to be part of this discussion, which is critical. Of course, we think that the nature of our work is really working across borders. That's why we were established in the first place. And I think that we have been able to break down a lot of barriers before and certainly during COVID-19, where we've seen an increased cooperation on several fronts and several areas where cooperation hadn't taken place before. And I think that was outlined very clearly by Professor Polari in his presentation at the beginning. One theme that I would like to pick on that you've mentioned is the theme of communication, especially when it comes to communication strategies, when it comes to being able to coordinate efforts in terms of communications to the public, communications to different stakeholders on vaccines and immunization. And I think that the COVID-19 pandemic has shown us again the importance of ensuring a consistency when it comes to key communication on vaccines, and especially the situation of rapidly evolving situation concerning the evidence that is coming out around these vaccines. It has been very clear, I think, from the very beginning of the rollout of the vaccination program, that the issue of potential inconsistency in the way we communicate about how programs are rolled out, in the way we communicate around certain specific products, is no doubt one of the drivers of hesitancy and one of the issues that causes acceptance issues when it comes to uptake. We are used to think of vaccination hesitancy and uptake issues mostly from the demand side, but we need to really think carefully also what happens on the supply side, and the fact that if we create consistency in the message that we give as public health authorities, that's of course an issue. And we know that the mechanistic way of communicating, in a unilateral way towards the public just does not work anymore. So I think that one critical area of cross-border collaboration is finding and devising ways in which we can probably work in a better, more timely, anticipating way on the messages that we give around vaccines and vaccination. The evidence behind the vaccines is really the same. The way we implement vaccination programs can be different for various reasons, also for valid reasons. But the way we communicate on the value of these vaccines and how these vaccines should be used should be something where we can find definitely consistency. Another area that you mentioned in the 13 boxes that you've shown us is the one about what can we do in terms of joint efforts when it comes to coordination around systematic literature reviews. And this is a topic that has always been at the heart of the work that we do at ECDC, and that has been at the heart of the collaboration among NITECs that we have established, and that has really bloomed. I like this word that you used during the COVID-19 pandemic. Of course, it's a challenge. Everybody's doing literature reviews. Everybody's looking at the evidence in their own way, according to their capacities and resources in their corners. But there is no reason why we would not be able also in that area to find efficiency gains. And I think that that has come out also very clearly from the draft report of the NITEC reflections that you have done within the NITEC's task within Work Package 4, which we've read with great interest. And that's something that we really want to look at. So from that point of view, I would say that our vision is to be able to better map what are the needs in the short, in the medium, and in the longer term of different NITECs working across Europe, and maybe finding a way of identifying efficiency in the way we use resources and avoiding reinventing the wheel, just as Alison mentioned earlier in the areas that she covered. Over from my side.
Thanks very much. I'm going to ask the same question to Jonas Sivile from Finland, also representing Work Package 8 on vaccine hesitancy.
Thanks, Sarah. Can you hear me? Good. Thanks for a great presentation and great comments from the previous panelists. On a very general, in a very general sense, having worked with the joint action and especially with vaccine hesitancy and uptake during the last 3.5 years, I would say that if we want to improve cross-border collaboration in general, we need to have concrete instruments and tools to do that. And I would say that the joint action has been a good example of an instrument that has brought us together and given us opportunities to collaborate, but we need more of these. You already mentioned the WHO group on behavioral and cultural insights community of practices group, which is another really good example of an instrument that exists, and that's very concrete. And I think it is through these that we sort of make it possible for us to collaborate even more, which is necessary for many reasons. Another good example is of a collaboration instrument is our Nordic vaccine acceptance and hesitancy group, which Sarah also is a member of, and the Nordic countries have already in 2018 we launched a group for people working at the different public health institutes with vaccine hesitancy and uptake issues. It's a mixed group, both with people both with working maybe more explicitly with research and with people working often more with communications, and both. But I would say that this is also maybe a good thing in the sense that it brings people from different backgrounds together to work with different issues. But I would say that key is different concrete instruments for us, and have those and make those sustainable, definitely.
Great, thank you. And finally, Sarah, do you have any additional comments on your vision by 2030 on any of these themes?
Yeah, thank you. I'd like to briefly comment on two of the themes, of the 13 themes that have been brought up. First, on adult vaccination, that is something that I think we're all dealing with in different ways and with different ambitions, and it really reflects the issue of lifelong or life course vaccinations that we're focusing a lot of children and youth, but in order not to get gaps of protection immunization waning until we get very old, I think it's important to look into how this can be accomplished. And I think this is also become evident by the COVID-19 vaccination work, and which we don't know yet what the future will be, but we're covering most ages, many of us, with these vaccinations, and we will probably for a fairly long time have to continue to boost and so on, and so perhaps that could be used also as a basis for widening up and looking into other diseases, vaccine preventable diseases. In Sweden, in order for a vaccination program to get the status of a program, national program, it has to be decided by the government, and then what follows is that the regional authorities have to provide the vaccines, and the cost is provided by the government. So, and we are now taking a first step this year by introducing pneumococcal vaccinations as for elderly and risk groups, I should say, as a vaccination program, national program. It's already been recommended, and many regions are already provided, but there's been differences in coverage depending on where you are in the country, where you live, and so on. So this is something we've been, Sarah mentioned that, also working together quite intensively on the COVID-19 vaccination campaigns. So it would be very nice, I think, to develop that further to other areas as well, and not drop the COVID-19, of course, then the other theme I'd like to comment briefly is related to that, and that concerns the technology tools. And again, the COVID-19 vaccines and vaccinations is a beautiful example of how we can and had to collaborate in order to go about this challenge. And it would be very nice to see that being expanded to and further developed into other areas as well. This could include vaccine development, but it has also included the regulatory aspects and other issues. But it could also technology tools could be anything from IIS to how to administrate vaccines and so on. So there, I think only fantasy can set the limits, and perhaps the work package working on research priorities will come into some aspects of this also. So I'll stop there. Thanks.
Thanks very much. Do we have any more time, Olivier? Great. Okay. I did want to go around the panel once more and just push you a little bit harder for some concrete actions. I think it's very good, the discussions that we've already had, but if you had to take one or two concrete steps in your own context to move forward to the vision that you've described to us, what would they be? Alison, I'll start with you.
Sure, thank you. So yes, I think this is, let's say, an easy one for me because I'm familiar with a lot of projects that are taking concrete actions right now. And I think given that we've already had excellent remarks from other colleagues on some of the specific topics, maybe I can mention, for example, you have working with pharmacists. And I would say it's even broader than that. It's working with healthcare professionals as a whole and associations of healthcare professionals. And I think many of you are probably already familiar with the Coalition for Vaccination, which was established in 2019 following the EU Council recommendations on vaccination. And this is an initiative of healthcare professionals and student associations working in the health field, who are all trying to come together to really coordinate their messaging around vaccines, to exchange on experiences, and to debunk common myths, kind of improve the communication with the public, because we all know that healthcare professionals consistently in survey after survey are found to be the most trusted source of information on vaccines. And so a very concrete step is to make sure that we can strengthen this existing coalition for vaccination by giving them more visibility, and also by creating more links with projects like EU-JAV, with institutions like ECDC, and ensuring that there's a space for them to continue to reach their communities, which are millions of healthcare workers across Europe, with their messages, and then also influence messaging happening in high-level fora by feeding up, from the bottom up, the kind of information that they receive from their members. So that's something that's very concrete that we're working on in a project. And then I'd also like to say about training, and specifically training of healthcare workers in relation to all of this. This is a huge focus that we're seeing across all of the projects, and there are a lot of really exciting initiatives coming up. So trainings of trainers, specifically around vaccine communication. I know that that's something we're working on within Immunion. It's also something that I believe ECDC is taking forward a number of initiatives on. There are some great activities coming out of a few of these projects on identifying, we talked about vaccine hesitancy. We'll hear more in Work Package 8 about this. But vaccine hesitancy is another huge focus across all of the projects. And there's a very interesting taxonomy of fallacious arguments around vaccines that's been introduced by the project JitsuVax. And they're going to use this kind of taxonomy to then develop a series of counter arguments that could be used against these types of common myths, and develop a training around this that's available for healthcare professionals. So I could go on and on. There are lots of interesting things, but yeah, I think the point being, the key message being, we need concrete tools, as Jonas was saying. We really need concrete tools and mechanisms to continue to have conversations like the one we're having today. And I think it's very important that member states who are represented within the EU-JAV are primary drivers for this, but that they don't only keep the member states themselves in mind. I think we need to really develop a big tent and think who else needs to be involved in these conversations, and whether that be coordinators of projects, whether that be representatives from the pharmaceutical industry, whoever it is. We know that we are sharing a common goal of trying to increase vaccine uptake, and collaborating and sharing on our specific actions is one of the best ways to do that. So thanks, Sarah.
Thanks. Karam, your 1 or 2 maximum concrete steps to move forward.
Sure. I think the first thing for us is to distinguish between wanting to support and to promote cross-border collaboration and expecting a unison or a harmonized way of doing things. I think it's very important to distinguish these two things. In the European project is the natural tendency or the natural way of doing things to want to harmonize, to want Europe to have a common approach. This is the case also in health, even if it's less so, of course, due to the limited competences. But I think we have to step back sometimes from these ambitions, from wanting things to be the same. They're not the same for valid reasons when it comes to the implementation of vaccination programs, historical reasons, cultural reasons, the way the healthcare systems are designed, etc. However, we can promote consistency, I think, in the way things are done, in the way we believe modernizing or bringing forward vaccination programs could mean or should mean, where they should go. So it's more about setting the goals, setting the objectives, and setting the standards, but then it's for countries to find the best way according to their context to do that. And more concretely, from our perspective, probably what we see makes sense, because we do work constantly on a cross-border dimension, is to foster in an active and a dynamic way an environment that is conducive to collaboration between the countries, feel safe in sharing their experiences, sharing their practices, documenting these practices, regularly building bridges between the countries. What we see is that this is what builds trust. This is what enables countries to talk to each other, what enables countries to then develop initiatives, which can be initiatives that are completely outside the work that ECDC does, or initiatives within the platforms that ECDC hosts. And I do agree with what Jonas says concerning the fact that we need concrete tools. But I would also challenge a little bit this idea, because there are a lot of tools that are either through, for example, the platforms we have available, or what the Commission has available, or what is funded through different EU funding programs. So perhaps it's also about better leveraging the tools that we have, refining the tools that we have, and finding ways that make sense for the countries, and also, of course, for the actors that are operating these platforms and tools to try to build this convergence. But I think the concrete step for us is really to continue to work very hard to foster a dynamic environment where countries can come together and where we can have a convening power, if you like, to be conducive to creating this collaborative environment where we believe is the first step for real cross-border collaboration.
That's great. Jonas, do you have any additional concrete steps? 1 or 2 maximum?
Or
no.
You can. Okay,
now,
good.
yes.
Thanks. Thanks, Karam. Just a quick answer to your comment there. What I was maybe meaning, or I'll try to articulate it better. I know we have a lot of concrete tools in the form of platforms and such, but what we need more, I think, is sort of tools that bring the people together, the people who work with these issues together, and have sustainable places for us to work with. And I already mentioned some examples, but well, looking at a couple of concrete steps, I would say we have already some of these collaborative spaces that we use and where we discuss. I think we're already in a stage where we can sort of take the next steps. We have been meeting and discussing things for a long time. I think it's in many of these groups and in many of these sort of collaborations, we are already in a place where we are able to do more concrete things together in the form of research, for example, in the form of different kinds of actions, activities, whatever that may be. It doesn't always have to be a campaign. Another thing which I would like to see is that often when we work with hesitancy and uptake issues, for example, which is quite normal because people who work with these issues come from different research institutes or public health agencies, we do a lot of research about how things are. We try to understand. I would say that we understand quite well already. We have quite a lot of studies. Of course, we need to be updated, and many of these studies need to be more context specific. But what we really need to push forward is the research-based actions based on all the knowledge we have. And when I look at the huge data we gathered in Work Package 8 that we will tell you about in a while this afternoon, we can see that a lot has been done. But there is a strong emphasis on research, understanding the topic, and less emphasis on actually doing something about that. So this would hopefully could be sort of a vision for the future. We have ongoing, just as a concrete example, we are participating in an ongoing Horizon 2020 project called Vax Trust, which both combines sort of two of these blue boxes you have here. We look at barriers and enablers in low vaccination populations, and based on this knowledge, we prepare a kind of a training or support for healthcare workers or professionals to encounter these issues. Just as an example of how the issues I just mentioned before could be tackled in the future better.
So
Thanks.
great, it's a great example. Thanks very much. And I fully agree with you that there's so much research going on, and we understand kind of what the research is saying in terms of what can be the drivers of low vaccination coverage, but what to do about it is so difficult. And actually then how to involve all the relevant stakeholders, both within a public health organization, then you're talking about also the communication teams, not just the scientific teams, but also the broader stakeholders that work much closer to these low vaccination communities, for example. Søren, the final word is with you. One or two concrete steps before we open up for questions from the audience.
Now it can be heard also, perhaps. I'd also plan to mention the importance of keeping the various arenas for meetings, common discussions, joint discussions, and so on, and further develop them. But it has been extensively covered now by Karam and Jonas. So finally, I'd just like to add that what we're here to present and discuss today, all the nice and important work that has been done through this joint action, it's important to further build on that, not to stop here and just report and move out and do something else, but to utilize what has been accomplished through the JAV that relates to much of these 13 themes and other issues as well. So it's just a kind of a general reminder to all of us. Thank you.
Great, thanks very much to the panel. Olivier, do we have a couple more minutes for any questions from the audience? A couple more minutes until 1:15. Are there anyone having a question from the audience or from the participants online? I think the questions can go to any of the panelists. Yes, please. Olivier, do you have a microphone?
Thank you very much. It was very interesting, and also this topic you're speaking with Bear Owen. represent European Specialist Nurses Federations in Europe. And I really want to push a little more good news. I see on in the very first slides that there's not much collaboration. And I see on the bigger countries in the West, on the East and the Balkan, I see a very different color pattern, where there is far more collaboration. So I really need to stress always good news. And if we're talking about vaccines hesitancy in the healthcare professionals, this is a really big concern also in our group. But we really make some really big steps, and we constantly doing a lot of surveys, and also windowing the importance of vaccination, not only pushing the uptake, but also the knowledge, communication, and also these kind of this kind of interventions. And I had a last remark, but just slipped out. Oh yeah, we do represent about 5 million nurses, and we are a group of cross-national nursing organizations, diabetes, rheumatologists, nurse directors, educators, intensive cares. And we do have a program on vaccination, and also including AMR and infection prevention. And for us, it's very important to connect with the national organizations, but this is a huge barrier for us. So we constantly try to engage with national representatives, national organizations, but as professional organizations, there seems to be a very big gap, just only the figures, but also the health professionals doing the work. So I think this is really a very important event, and I was also there with the first meeting in September in 2018, so I'm really pleased to be here. And I also follow the remarks in the opening sessions that there's still a lot to do, and this is our call. But I would like to see that the healthcare professionals are more able to work with national representatives on this. Thank you.
Thank you. Very important comments there from the nursing side. Any more questions or comments from the audience here or from the participants online? Very welcome to ask questions, make your comments.
Not for the moment.
No.
Not for the moment.
Not for the moment. Okay, perfect. But then we'll close the session. Thank you very much.